Good morning, good evening, good afternoon, depending where you are based, and welcome to this third edition of the Global Public Health Week organized by the World Federation of Public Health Association. I'm Marta Lamazzi, Executive Manager of the World Federation of Public Health Association. And today I have the great pleasure to discuss with Dr. Dragoslav Popovic about how the pandemic has impacted the health system in the Southeast Europe. Welcome, Dragoslav.
Thank you very much for this opportunity.
So a few words about our speaker of today first. Dragoslav has over 30 years of experience in international public health, of which 20 years with UNICEF at country, regional, and headquarter levels. His recent collaboration include the World Bank, WHO, UNDP, Gavi Alliance, Crohn Agent, JSI, and USAID. He has completed his Doctor of Medicine degree at the University of Sarajevo, Master of Public Health at the University in Belgrade, and he has also a postgraduate course in social policy and governance at the University of Maastricht. And it's a pleasure to work with him since many years, since he's a member of our International Immunization Policy Task Force. That said, let's enter in the main part of our interview today to get a better understanding on the situation that you are living in this part of Europe as a consequence of the pandemic. So my first question for you, Dragoslav, is how the pandemic has impacted the overall public health infrastructure in the Southeast Europe, and also what measures are being taken to address any shortcomings or vulnerability exposed during the crisis.
Yeah, thank you very much, Marta, for this opportunity. I think it's important to bring some insights from this part of the world, which is sort of in Europe, but is not a part of the EU. And the countries that are certainly part of the Eastern Europe with a bit of a joint history and sometimes a very different response to the pandemic challenges. I mean, certainly it was one of the major issues that happens to us over the past couple of years. And we would really be happy to have some sort of evaluation of the pandemic response right now to share with the audience. But unfortunately, we don't have any kind of formal document that would help us really to guide these discussions. And apparently the real problem is the absence of a good review, evaluation, and taking the lessons from the pandemic, because it would be extremely important for all these countries in a case of the next pandemic, and certainly in building capacity for the any kind of public health emergency. As I was saying, we were part of the Europe. The countries declared the emergency stage, let's say, soon after the European countries have done that. And if we're looking from today's perspective, we can say that the results of the pandemic response were mixed, but the results of the pandemic response exposed really some of the weaknesses of the health systems, and also provided some of the valuable lessons learned. So I don't want to be too let's say negative about the some of the results. I would rather look forward and discuss with you and our audience what was good that we can use from this pandemic experience and strengthen it as soon as possible, so that we can do next time better. If we look at the results, if we look at the pandemic response, let's start from there. The country started a very strict emergency measures with closing the borders, restricting the traffic, controlling the traffic of the passengers in and out of a country. Even at some countries, we were having police and the army at the borders. They started strict identification of the cases with the quarantine and the follow-up by the epidemiologists. But I think all these measures were sort of without enough breadth, and soon we seen that there is no capacity for some of the essential functions, particularly when it comes to imposing the quarantine on so many people who were positive with the COVID. And also, as we have seen the surge of very soon surge of COVID cases, so the hospitals and other primary healthcare institutions were overwhelmed with the COVID patients. Also, I have to say one of the key issue in the region was basically lack of a leadership. In some countries, we were having that the political leaders were seeing the pandemic as the opportunity to be a main conductors of lives of a people, and they were very often taking the lead in controlling everything, imposing some measures, shutting down some others. And there was a lot of let's say wandering in the mess in the pandemic response. What was some of the major lessons and major results? We were not much different from the other European countries when it comes to the number of cases, and I think we have done a relatively good job in creating capacity to follow up on the diagnostics and on surveillance of the COVID, and also sharing information with the other countries around us and the international organizations that were concerned with the pandemic response. We had also, I think, have done a good job in trying to provide assistance and medical assistance and access to basic services to all people that needed medical assistance. But I have to say the results were not so good, and this is something that we really need to look at critically. Because despite of having high access to primary healthcare, to secondary healthcare, even to tertiary healthcare and the famous respirators or ventilation support in the critical care units, our, let's say, mortality rates and the efficiency of our treatments were suboptimal concerning the everything which was available. The countries in this region have one of the highest so-called the surplus of mortality. In a different, if you look at the different data, the Russia is always on the top. Bulgaria and Serbia are among the first 3 or 5. So the surplus mortality, which clearly has to be linked to the COVID, it's something that is a sign of a great burden and even tragedy that COVID-19 pandemics brought to this region. Serbia lost something close to over 60,000 people within the 2 years, and I have to say many of those deaths could have been prevented. Among the major lessons, I think that we really need to improve the capacity of the epidemiological services to detect, to really survey and to follow up with so many cases of really deadly infections. Another issue was related to public health measures, particularly when it comes to preventions. We have seen that we really need a different capacity and a different approach in communication with the public, but also in imposing some of the measures which could help population to adjust their own behaviors to the circumstances, and also to address and counteract the infodemia and many of the different information we are struggling from during the days of a pandemic. That's in a nutshell, but I really believe that we as a group of very similar countries, and the countries where collaboration among health workers is improving on very much, should sit down and organize some kind of serious discussions around how can we do better. And on a positive note, just to pick up couple of issues that for me were extremely important. I think that WHO and the Mayo Clinic set up the Viber group to help clinicians to get latest information and to share information and experience among themselves. That group at some point consisted of almost 5,000 health professionals from the red zone in 7 or 8 countries of this region. And it was extremely active group, and I think was a great support to the people in the red zone, that they were able to get the latest information, but get also experience from the colleagues that are in a very similar situation as them, and seek for help if they need it. I think that's something that is really great experience that we should be using more. I think another one another one is that during pandemic, the private sector, for example, private company in the Federation of Bosnia donated software for following COVID to the Federation, and that software was used by the public health officials who can see the latest information on the screen of their phone. Similar thing happened in Serbia within the week or two. They have developed excellent system for tracking and inviting people for the COVID vaccination. It functions during the COVID. It was shut down after, and 2 year and plus after the emergency stage of a pandemic was over, we still don't have a software that would work and follow electronic immunization records that would be functional. So yeah, we've shown that some things can be done in the emergency, that emergency provides some sort of opportunities, but we need to find a way how to sustain that, how to improve, and how to set up a better system for the next pandemic.
Thank you very much for this very broad overview of the challenges and also the good practice you could develop for the management of the pandemic. I will ask you now a very tricky question. If you could go back at the beginning of the pandemic and change one thing that will have a big impact on the pandemic management, what you will do?
I think the one thing is to ask those people to speak in key messages. And I mean, people who are coordinating communication overall. Because what we have seen is that those key messages were very often lost in a big buzz in the media, and they lost their power, and they were not reaching sufficiently the population that was targeted by those messages. I think the communication is critical, and information is critical in this kind of situation. We have enormous power in the media, in the social media, but we were not effective in using those, and we were providing a lot of space for the misinformation, for the different groups that were doing more damage than good.
Absolutely. I guess the problem of misinformation, of fake news was really a big issue for the pandemic all around the world. And this is where the public health professional need to really improve and to do better, not only during pandemic, but in general, to really build a trust in the health system, and making sure also that when we need a fast answer from our communities, they trust the health system, they trust us as health professionals, and so they comply with what is needed. Thank you very much, Dragoslav. Another big issue related to the pandemic is mental health. Now that somehow we are managing the pandemic through vaccination and other preventive means, we observe everywhere in the world the problem of mental health affecting all the life span of people, from very young to old and older adults too. Is it the case also in Southeast Europe? And if so, how are you managing this problem?
Absolutely, it's a case we need to learn more about it and have more information to support our case. But what we were seeing during the pandemic, that different restrictive measures were affecting different population disproportionately. Of course, you know, in the beginning, the elderly people were under greater strains because their movement was strictly restricted. Their communication with the other people was also restricted, and you know, we are also a very old aged population, where many of these people would be living alone without social support, and that period of restriction in movements and the messaging that they were getting were really having effect on their mental health. And of course, you know, another group is health workers, particularly those who were working in a so-called red zone. There are some data that we published on the level of stress and the level of the problems that they were enduring, and we also need to understand a couple of things. One is that not all health workers were equally under stress during the pandemic response. Those who were in the red zones, those who were working in the so-called COVID units at the primary healthcare, were really under great pressure. They were working long shifts. And we realized that the service that couple of decades ago existed in those countries, such as psychologists who will work with the health workers, doesn't exist any longer. In Serbia, it was the case that, for example, that psychologist support exists only within the military medical units. And those psychologists that were trying to help the other colleagues realize how big the problem is. They were bringing this up. We were trying to help, but it's not about just helping these people in the situation of a big stress, but also providing them some kind of longer term support. Another issue I have to flag here is that many of these people were having issues with the mental health, not only because they were working long shifts, dealing with terminal ill patients, or lacking support from their colleagues and the other parts of the health systems, but also we had a huge issue with the lack of personal protective equipment in the first days of first weeks of the COVID response. In Serbia, we had 104 health workers, and I'm talking about doctors and pharmacists. We don't know how many, for example, nurses, medical technicians, or other staff have passed away. That was a huge, and when you're comparing to some other countries, when you're comparing to even countries that are not so far from here, like from Slovenia, they had 0 death cases among the health workers. That was one of the huge issues that it really needs to be examined and need not to repeat anytime in the future.
Absolutely. This is part of protecting the health system and its workers, and we cannot guarantee a system that works. We cannot guarantee community to be protected neither. So, of course, they should be really a high priority for whatever will happen in
the
future.
Helpers who are health workers in this kind of situation, and not only to be protected from the infectious and the imminent threat, but also to be helped to keep their mental health in order to be fully efficient and able to help the other people.
Absolutely. So looking ahead, as we have started doing with how to protect the health workers and the health system, what are for you the key priorities and strategies that should be put in place for, let's say, long-term recoveries and resilience in the public health system in the Southeast Europe, based also on what you learn from the pandemic management?
I think that one thing that we knew in I think all countries of this region is that public health systems moved away from their original role of protecting, preventing, and promoting health into service for those who are already ill or already have some health conditions to be treated. And that's I think the critical issue for all policymakers is how we really create again a capacity that would work on the protection and health promotion. This is because we have, if we look at what are the major threats that we have, is that all of those, if we exclude emergencies and the pandemics, all others are related to the people's behavior, healthy lifestyles, and certainly we don't have a capacity to promote those and help people to stay healthy and as long as possible, and be able to keep and preserve their health and a quality of life, such a population will seek less medical care, will use less of the drugs, will have a better life, and we be better satisfied with what is the challenge of a life. Coming to that, another major issue is the epidemiological transition. We have aging population. We have more and more people that are in the senior years of life, and they need different sort of support. So we really need to develop strong service for those people, and that doesn't need to be hospitals, hospices, or a big sort of established institutions. Some of the issues that these people are facing with can be easily sorted out by telemedicine, by better organization of the public health services, by collaboration with the community organizations, and with the peer-to-peer support. So that's the I would say the major issue for all health systems in the future. Lastly, we have seen in all countries that the private sector came out of this pandemic stronger as ever, and that's a good thing. That's not a bad thing at all. But the problem is that there is really no collaboration, or not sufficient collaboration and coordination between the private sector and the public sector. And we see that the inequalities in access to healthcare are really increasing for a number of reasons. When it comes to private sector, those who can afford and those who are more concerns for their own health, or those who have better information, will find a way to get the service they need. The others would be in a totally different situation, and those people who are excluded or deprived, there are often those who need healthcare more than the others. So that's, I think, another big challenge between the really collaboration of the two systems, because we are using the health workforce. There is a huge brain drain from this region. Every month we have less health workers. We are, when you look at the figures in terms of how many doctors and nurses we have per 1,000 or 100,000 population, we are under the EU average, and more people are really moving towards the other countries where there are better opportunities. And without combining the force in the private and in the public health sector, we cannot achieve goals that we need to achieve, and we cannot reach those who need healthcare the most.
Thank you very much, Dr. Popovic. And with this message of hope to have a more equitable access to prevention and to care to each member of our community, I would like to thank you very much for this interview, very insightful. I would like to thank also those that are following our interview on our social media and more broadly the Global Public Health Week. Feel free to get more information about our International Immunization Policy Task Force, checking on our website, WFPHA.org, and also asking a question or sharing comments under this video. I wish you all a very good end of the day, and I thanks again our amazing speaker for having shared all these thoughtful ideas and experience with us that will help for sure to build a better and more resilient health system in Europe and beyond. Thank you very much.
Thank you.